Today's class would be regarding some of the important orthopedic conditions around the elbow joint and the wrist joint. First of all, very important question asked, tennis elbow. On the lower end of the humerus, we have got the medial and the lateral epicondyle. First of all, the lateral epicondyle. The lateral epicondyle has got an important function that it serves as a common extensor origin. All the extensor tendons of the forearm arise from this point at the lateral epicondyle. An inflammation of the lateral epicondyle would be called as lateral epicondylitis, and that would be synonymous with tennis elbow. Tennis players usually get this condition, but it's not limited to the tennis players. Even cricketers who overuse the lateral side of their arm and forearm can get this condition. An example, Sachin Tendulkar. He had this clinical condition for some time. Exactly opposite to it is the medial epicondyle, which is a common flexor origin. It would give rise to muscles, flexor muscles of the forearm. An inflammation of this part would be medial epicondylitis, also known as the golfer's elbow, but again not limited to golfers only. The third clinical condition around the elbow joint would be especially the presence of a bursa, olecranon bursa over here, and sometimes inflammation of this bursa can occur, and this is very frequently in students who constantly use their hands in this position. A chronic inflammation of olecranon bursa would give rise to student's elbow. So tennis elbow, golfer's elbow, student's elbow. We would have another terminology associated with the elbow, and that would be base pitcher's elbow. And what it means, it just means an injury to the bones, to the soft tissues around the elbow joint. Quite distinct from the former three elbows which I discussed. In addition to this, we have got the wrist joint. The wrist joint can sometimes assume a shape or a position like this, and this would be called as a classic wrist drop. This classic wrist drop is a result of an injury to the radial nerve. Now, what is this wrist drop? It is basically unopposed flexion, because radial nerve would be supplying all the extensor muscles of the forearm, and the wrist would be in a position of constant flexion, unopposed flexion. So the position of the wrist like this is synonymous with wrist drop caused by injury to the radial nerve higher up. We are frequently asked about one condition, and that is the carpal tunnel syndrome. We have got the flexor reticulum over here, and in line with that we have got a tunnel, carpal tunnel, formed by the proximal and the distal row of the carpal bones. And this tunnel, through this tunnel, we have got very important structures passing through, and one of the very important structures happens to be the median nerve. The median nerve arises from the medial chorda of the brachial plexus. Now, this median nerve can get entrapped, what we call as entrapment neuropathy. And this carpal tunnel syndrome is basically an entrapment neuropathy of the median nerve in the region of the wrist or the flexor reticulum. Now, it will be especially seen in females who would constantly complain of pain, numbness, tingling in their hands while doing routine day-to-day activities like washing, wringing their clothes, or other routine activities. The causes of carpal tunnel syndrome can be many, multiple. A generalized cause would be accumulation of fluid within the carpal tunnel, which can be seen in physiological conditions in females like pregnancy. Or it can also be seen in generalized swellings like anasarca, generalized anasarca, nephrotic syndrome, cardiac failure. Late stages though. This carpal tunnel syndrome can be seen as a result of rheumatoid arthritis as well. In addition to rheumatoid arthritis, certain endocrinopathies like diabetes mellitus, hypothyroidism, myxedema, we can have this carpal tunnel syndrome. In addition, trauma to lunate, dislocation of lunate can cause carpal tunnel syndrome. And what would be the predominant features would be pain, numbness, and tingling, what I have already mentioned. There may be wasting of thinner muscles on long-standing cases of carpal tunnel syndrome. Now, there are two important tests through which we test the functioning of the median nerve in the carpal tunnel syndrome. One is the Tinel sign, and the Tinel sign is direct percussion along the median nerve in the carpal tunnel region, which would produce paresthesia. And second thing would be the Fallon's test, and Fallon's test would be wrist flexion sign, that once we flex the wrist, there would be pain and numbness in this region, and once we just straighten the hand, that thing would go off. So these are some of the very important things associated around the elbow joint and the wrist joint. I hope this class of mine would be useful to you from your examination. Thanks a lot.